Hi there, this is Dr. Chung. These are the main points of guidance that I usually go over at the 2-week-old well-child check. At this age, your child's stomach is still relatively on the small side, so we say continue to feed relatively frequently, at least 8 times per 24 hours. If your child is feeding frequently during the day and you know that you're going to hit that minimum of 8 feeds per day, then it is allowable to give your child 4 to 4.5 hour stretch to sleep longer at night so that everyone can get a little bit more rest if your child is allowing you to do that. And if they aren't, then they eventually will. If you're breastfeeding, until they become more vigorous, they may need more time at the breast. So we continue the rough estimate of aiming for around 15 to 20 minutes each breast. If your child happens to be more efficient and feeding for a shorter duration, then you don't have to prescriptively follow that timeline and just continue to feed until your child seems full and disinterested, like they're turning their head away and not seemingly interested in suckling any longer. If you would like to do some bottle feeding, then it becomes appropriate to do so as breastfeeding gets more well established. As the child gets older, there's less of a risk that introducing a bottle here and there, maybe at night, so that mother can get rest, is very reasonable. And the later in life that you do that, the less of a chance that it interferes with the child getting used to breastfeeding. So appropriate to introduce the bottle after breastfeeding is well established, after 2 to 3 weeks old. And that's the same concept with the pacifier. Appropriate to use the pacifier more frequently after approximately 2 to 3 weeks old if breastfeeding is well established. If you're bottle feeding, the rough estimate of what a 2-week-old full-term infant will take in is approximately 2 to 3 ounces at a time, but every child is different as far as how vigorous they are, how quickly their stomach gets bigger. So you don't have to follow that 2 to 3 ounces, again, prescriptively, but you can feed until your child seems full. It seems like they're not interested in feeding any longer and stop at that time. At a certain volume, if your child seems to be spitting up a lot more than previously, then you may have to, for the time being, dial back down to a lower volume, and then eventually you can continue to slowly increase the volume as their stomach gets bigger. And of course, for parents who have chosen bottle feeding, we support you 100% in that decision. Other general recommendations we give at 2 weeks old is that this is a good age to start some tummy time. For tummy time, you just place your infant in this army crawl type position on their stomach and any flat surface, and you let them hang out there for however many minutes they'll tolerate, a few times per day. And we say to gradually increase the tummy time to reach at least 15 to 30 minutes cumulative by 2 months old. So just slowly increase the tummy time as your child gets older. It's good for motor development. But when you start off, don't feel like you have to do it a lot if they seem to not enjoy it too much in the beginning. As a reminder, if your child is breastfed, then they should receive once a day vitamin D supplements. That's the one thing that's not passed reliably through the breast milk to ensure continued strong bones, optimal immune system, and growth. Developmentally, there's not a lot a 2-week-old is expected to do. One of the things that we would look for is just making some type of eye blinking or startling movements to loud noises. At the next video, I'll go over the usual recommendations that we go over at the 1-month-old well-child check. Thanks, everyone.